Module 2, the 10-Minute Medic, an expectation guide on documentation for HCFR engine medics during the first 10 minutes of a patient encounter. The HCFR Training Division has developed the 10-Minute Medic course with a standalone engine paramedic in mind. This course identifies the basic requirements for medical record documentation by an engine medic. It also sets expectations for the rescue officer crafting the transport report. When we discuss HCFR medical documentation, there are 2 run reports for each patient. Standalone medics are typically first on scene. They have a responsibility to report their findings, actions, and outcomes through to the patient transfer. What should be included in your run report? Well, to begin with, how was the call dispatched? How does the patient present? What is the chief complaint? The next step in crafting your report would include the assessment. What evaluations did you perform? ABCs or CABs? Did you check mentation, skin condition, the patient's hemodynamics? What instrumentation did you use? All of these need to be included in your run report. Following the assessment phase, we move into the stage of findings. What have you discovered about your patient? What is your plan? What are your treatments going to be for this patient? Findings quickly moves to actions. What are you going to do for this patient? Based upon your findings, what actions, what treatments are you providing for your patient? When we talk about actions, we also have to talk about inactions and omissions. What didn't you do for your patient? Because sometimes there really is a rationale for withholding a treatment. When that occurs, you need to document why. The next stage in your run report, outcomes. How the patient responded. You need to clearly qualify how the patient's complaint changed or didn't change. Now we move into the transfer phase. You need to document the handoff of your patient. Don't fumble this. Qualify how the patient's complaint changed or didn't change in your verbal report to the rescue officer, and also in your written report for document. As you learned in Module 1 of the 10-Minute Medic series, HCFR now uses a system called acuity profiling for our medical patients. Make sure that the receiving officer understands completely the acuity profile that you have placed the patient into. Confirm this verbally with the officer and also in your report to document. Refreshing you on the concept of acuity profiling for the HCFR medical patient, we have 3 categories: critical ALS, stable ALS, and BLS. If you have any questions on this concept, make sure you go back to Module 1 on the HCFR training channel and become completely familiar with this profiling. As a reminder for all paramedics, HCFR Rescue Division now data mines all paramedic interventions. Make sure that your report includes all of the crew members that performed any on-scene procedures. Both the standalone and the rescue officer need to create high-quality incident reports that accurately reflect what happened during the rescuer-patient encounter. 2 run reports, 1 patient, 2 distinct responsibilities. This completes Module 2 of the 10-Minute Medic series, an expectation guide on documentation for HCFR engine medics during the first 10 minutes of a patient encounter. Thanks for listening. Remember, every day is a training day.